Pediatric Orthopedic Surgeon. So I'm an orthopedic surgeon who has spent some time with further training to look after children, and my practice only deals with children with spinal problems. So usually Monday and Tuesday are all meetings for me. On a Wednesday, I typically would operate, and on a Thursday I would typically be in clinic, and then on a Friday I sometimes operate as well. I also have several commitments outside of the city, so I'm out of town a lot. It can be a lot of fun. I mean, you take care of people. It's not fun if somebody's sick or if something hasn't gone well, but people put their trust in you, and even when things aren't going well, it's usually still a good relationship. People realize you're trying to help their child, and most people are very, very grateful that you're trying to help their child. And if it's a particularly difficult problem, most people can understand that. You know, it's sometimes not like changing a light bulb. You know, that it's and people have a tremendous ability to understand the complexity of some of their children's problems. So I really enjoy it. I spend time chatting with patients, and like, not even about their medical condition. It's a nice part of the job, I think, is interacting with people and getting to know them. I often tell parents in my clinic that, you know, they'll come with children who have problems where the body hasn't formed normally. And, you know, they always want to know why. Like, what did I do? First of all, parental guilt is a huge problem, right? But they want to know, what did I do wrong? Why? How did this happen, right? And usually you can't determine what's caused the abnormality. And I tell them, I'm always amazed that it goes right most of the time. When you think about how the body forms and all of the divisions of all of those cells and the alignment of everything so that you get people that look like you and I think it's fascinating that it can work. So it truly is a wonder that this process almost all the time ends up with these perfect little people. Deciding I wanted to do medicine was something that I decided in high school, and I'll be quite honest with you, I don't know why. I've always had a real science background, and science and math has been my strongest academic areas throughout school. And somewhere I just decided I wanted to be a physician. I think it's a great job. I would encourage anybody who's interested to consider it. Despite what we might read in the newspapers about the challenges of healthcare, and there are lots of challenges in healthcare, it's still a great job. You work hard, things are improving, but people are starting to understand work-life balance better than has been in the past. So I think that that's important, and I'm a big believer in that. I may not be a great role model in that, but I'm a big believer in that. And I think that if you're thinking about medicine, you should also think about other things. You should talk to people who are in the field, but you should always have fallback positions, but also you should really know that that's what you want. We sometimes get people coming into our residency programs who, I want to do orthopedic surgery. And all they've experienced through medical school is they've done as much of their elective time in orthopedics as they can possibly get. And that used to be encouraged, but I actually encourage the opposite. I actually encourage them to sample so that they know that that's what they really want. And same with choosing medicine, you know, you should consider some of these other things. Like, there are lots of cool jobs in the world, right? And I think you want to know that you've made the right choice, and you can only know, well, you may only know that in retrospect, but as long as you've experienced some other things, you'll probably make a smart decision.